Good evening. I'm Melanie Risden with the Western Standard, and we're just looking at some numbers across the world where it comes to COVID cases, and looking at some of the countries that have moved away from the restrictions, moved away from mandates, and seeing how they're faring right now. And joining me is Derek Frum. He's a lawyer out of Airdrie with Warnock Craft Anderson law firm. And Derek is speaking with us today, just helping get an understanding of some of the context behind these differing numbers, where we're seeing a huge difference in case numbers in these countries that have adopted very different policies from others. So thanks for joining us, Derek. And fill us in a little bit. We were specifically looking at Norway and how it's been a month since Norway has done away with the restrictions in the country. And they're seeing some significant a significant reduction in numbers compared to some of the surrounding European nations around them.
Yeah, I guess the news out of Norway is that there is no news out of Norway. And
right.
that, from what we're being told, that should be shocking. But I think what's more shocking is that it's not news. It's not news, and that's probably a good thing. So what's happened in Norway is they've greatly reduced the restrictions on the population there. And from what we're told in the common narrative is that we should expect an enormous rise in COVID cases and related deaths and other such things. But that doesn't seem to be happening, at least not at this point. Now, when you compare similar countries, the devil's always in the details. It's not easy to compare across jurisdictions for a number of reasons. There's different government policies in place, different healthcare systems, different cultures potentially. If they're at different latitudes, seasonality might affect the way COVID acts. And Norway, for whatever reason, seems to be doing fairly well with the no restrictions pandemic response at this point. And
yeah, they seem to.
I'm going to have to look away from the screen here for a moment, but comparing to Latvia, Lithuania, Estonia, other countries in Europe, it seems like Norway is doing exceptionally well. And that could be a number of things, like, for instance, since most deaths from COVID do happen in older populations, it could be related to the fact that Norway has a different system for elderly care. And it could be that their way of doing things, which my understanding is they keep smaller sorts of home settings, more like a hospice. There's fewer individuals. And that could result in less spread, as opposed to what happened in Sweden early in the pandemic, where there's large facilities with many seniors and large numbers of staff. That sort of thing may actually make a population prone to catching COVID and ultimately passing away from the disease.
Right. So interestingly, to look at some of those fine details, as you mentioned, perhaps those are something, other nations can learn from. I know, especially here in North America, our elderly care facilities are massive, with many staff and, hundreds and hundreds of elderly people in the care facilities. So perhaps there's something that can be learned there. But what else kind of strikes you as interesting? Anything else in the details?
Well, I think it's also important to note that in this particular study, that Sweden seems to be doing fairly well. Again, Sweden very early on took flack from the entire world for following a traditional pandemic response, for following the response that actually the WHO recommended be taken. And they did suffer greatly early on. And that's not necessarily due to the government's restrictions put on the population, I should say. That's an assumption that people make. That it could be more related to cultural differences. It could be related to things like prior flu seasons, how much so-called dry tinder there was in the population. But now, looking at this data, Sweden is actually still doing fairly well. It's lower than many places in this study. But right in there, we have Norway right at the bottom of the pack. No news in Norway, and there's no passport. There's no mandates. Those sorts of restrictions do not seem to be in place in Norway. And what it tells me is that accepting a one-size-fits-all approach across an entire population is foolish. Canada is a vast country, and healthcare is provincial. And so in some ways, I think Canada is more akin to Europe in some ways, because we have different jurisdictions delivering healthcare in a different way, different regional cultures. Canada is more akin to that than a large homogenous nation. And I would like to say that Canada's response should be more greatly tailored to the particular circumstances of that region. And this clearly shows that it is very possible to avoid the deaths associated with COVID without having the sort of restrictions that we're constantly being told are necessary to protect people. It doesn't seem to be any demonstrable causal link between those two things. And in my opinion, what happens is, as soon as you have a sort of precautionary approach, you get lax with your understanding of causation. Assumptions slip into your reasoning, and you start to be a little easy on yourself, demonstrating that your restrictions are effective. And so this is the latest. I think is very interesting that deaths don't seem to be associated with these the lifting of restrictions in Norway. But this, in my opinion, this should not be unexpected, because there was a study recently in the last 6 weeks out of the European Journal of Epidemiology that surveyed, now I think it was 68 countries, relying on publicly available data from Our World in Data, and then close to 3,000 counties in the United States. So it's very broad, and there's millions of people involved. And they found there was absolutely no correlation between rates of vaccination and COVID cases. Now, cases are different than deaths, but without cases, you don't get deaths. And so this is fascinating, because if the vaccine is actually preventing cases, you would expect the data to have a signal in it demonstrating its efficacy. But that signal seems to be missing. And even though this is observational data, and it's the sort of weak epidemiology that got us into a lot of the mess that we're in right now, I hesitate to even call this sort of observational data scientific, because it is weak. But when your weak data clearly demonstrates there is no signal, that should be a real wrench in the gears for the individuals who are pushing vaccines, pushing lockdowns, these sorts of things.
Right, and of course, there's a lot of talk around the fact that the vaccine's efficacy is waning over time, and this is sort of what health officials are speaking to when you're seeing results coming out of, say, Israel, where it's actually being found that more cases are showing up in the vaccinated population. Now, again, that's not saying that more vaccinated people are becoming hospitalized or deathly ill, but again, it's a transmissibility issue that I believe at one point the idea was that the vaccines were to prevent transmission. Clearly, that's been debunked, and it is transmissible from both the vaccinated and the unvaccinated population, which we're even seeing those results in Alberta with higher case numbers in the vaccinated population. Again, many argue that there are more people vaccinated, so of course you're going to see more cases in the vaccinated population. But again, I understand where you're coming from, and I agree that at some level there should be a marked, there should be marked evidence that these vaccines are preventing more of the cases, but perhaps it's just they're not capable of preventing transmission, which I believe is what they're finding.
Yeah, I think that's very clear. It's very clear the vaccine does not prevent transmission. There's no credible person that says otherwise.
Right.
That is extremely clear. And regarding the Alberta context here, I think it's a very good point that people make in response that, well, yeah, of course we're going to see more cases in the vaccinated crowd. It's 80%
It's a
of people
higher number. Right.
and yeah, and that's true. But they've moved the goalposts again, haven't they? Because as you pointed out, the point was that the vaccine was going to prevent transmission and end the pandemic. And that's clearly not the case. They've
Right.
moved the goalposts, and that isn't even subtle. That's just blatant. The vaccine was supposed to get us out of the pandemic, was supposed to generate herd immunity, and it's incapable of both. So now the response is, well, we need to get everyone vaccinated to protect from severe symptoms. And while I'm willing to say at this point, I don't know. I haven't heard evidence to contradict that claim. It seems like the vaccine does offer some protection against the severe symptoms of COVID, certainly over the period where it's found to be effective, which is 6 months. And with more frequent boosters, that period seems to wane, maybe down to 90 days. But at that point, again, you know what? We've set ourselves on a course that is going to be hard to get off. It's the sort of course that's going to require indefinite boosters in order to maintain that protective element in the vaccine. And we have no data on whether or not that's going to disappear in time either. And what seems to be troubling now is that data out of Israel, who is ahead on the curve and has largely, at least maybe exclusively, even used the Pfizer vaccine. It doesn't seem to be working quite the way they had hoped, in the sense that individuals who have the waning immunity from the vaccine, once that's gone, individuals who have been fully vaccinated seem to be more susceptible to becoming a COVID case. Now, if you're protected from the severe symptoms of COVID, and you're protected from experiencing symptoms of COVID because you're vaccinated, and you're carrying the same sort of viral load. In fact, there's studies showing that people who are fully immunized or fully vaccinated, that they carry an increased viral load, and they may not even realize it. Well, we've just created a super spreader. We've created the super spreader that's going to keep the pandemic going indefinitely. And so it is problematic. I think this is the problem with leaky vaccines. This is a vaccine that doesn't confer sterilizing immunity and allows the individual both to become infected and to spread the virus. Those sorts of vaccines have often, when they've been caught, have been stopped. And I think we've fully committed to probably a foolhardy course of dealing with the pandemic. Norway seems to show that dropping restrictions and not having this sort of vaccine mandate, or the heavy incentives that we're dealing with here in Alberta to become immunized, it doesn't seem to be related directly to COVID deaths. That's unhinged, at least in Norway. We need to explore why. Maybe we can do the same here. And we look at the other study with the massive amount of data that was analyzed, and that vaccination rates do not signal any sort of protection against COVID cases across the populations. It doesn't seem to be the case. We would expect to see a strong signal. So we're not protecting against cases. We're not protecting against deaths. I think it's time to reevaluate the policy.
So clearly the topic, or the concept of this being a pandemic of the unvaccinated, your comment on that?
Well, I don't have data particularly on that. I do know that COVID is a real disease and that people can catch it. I do believe that we have a failing healthcare system at the best of times. And so that any increased load on that healthcare system, particularly when healthcare staff have their hands tied of actually treating COVID before someone becomes a hospitalized case, that's the sort of thing that's going to end in disaster. And it doesn't take COVID to do that. when we're looking at it, it's only how many people are we told in ICU that will overrun our capacity? Less than 500.
Yeah.
That a disastrous event at a major, like a major sporting event, could cripple our healthcare system just that easily. This is how fragile our healthcare system is. And so COVID is real, and it can cause bad consequences. And I'm not convinced that this is an epidemic of the unvaccinated or vaccinated. I think it's more of an indication of how shoddy and slapped together and on the verge of collapse our healthcare system is at all times.
Now, you're supporting a number of clients in a number of ways with legal action, again, on a number of fronts. In your legal opinion, then, with the fact that this data that seems to be coming out showing that there really is not a huge difference between the protection or efficacy of a vaccinated person compared to unvaccinated, how do you see that affecting the potential for these mandates to be defeated, or what are your thoughts there legally?
Well, the gatekeeper for all these arguments since the beginning of the pandemic has always been Section 1 of the Charter. And Section 1 of the Charter is that moment where the government in court needs to justify its actions that have engaged or limited the rights enumerated in the Charter. So, for instance, for religious freedom, by restricting access to church services, saying singing can't happen, gathering can't happen, you have to go to Zoom. That is an obvious engagement of the right in the Charter of religious freedom. The question only really remains for cases like that is whether that can be demonstrably justified, that engagement or restriction on that right. And cases like this or studies like this show, I think, a number of things. A plausible and good argument can be made that, look, government, you cannot rely on this precautionary approach. There's data now emerging from around the world showing that what you're trying to be cautious of isn't actually going to obtain in the real world necessarily. So, for instance, if people gather in church and they're not vaccinated, will that prevent the spread? Doesn't seem like it. Will it prevent, if you force healthcare workers to immunize, will that prevent the spread? Probably not. In fact, it may have exactly the opposite consequence, where you have your fully immunized healthcare staff who are now super spreaders and in the healthcare setting. That might be a disaster.
Right, and I did hear a doctor sort of reference that as well, that these immunized healthcare workers could be carrying COVID and, as you mentioned, have little to no symptoms, so not even think that they're sick when they are carrying a fairly substantial viral load that could be spreading to patients and other coworkers. So yeah, there's definitely an issue there.
Yeah, and so the burden for the government in light of evidence like this, and there's mountains of evidence like this, the burden becomes very difficult for the government to satisfy that its restrictions are the only way to deal with this pandemic, to deal with the real threat posed by COVID. And in the end, that is the government's burden. They have to defend the particular policy choices they've made based upon data that they can demonstrate. And it's becoming increasingly difficult for the government to do so, in my opinion.
Well, and my guess is that as this data keeps coming out and unfolding, it's working to your benefit with your clients who you're supporting. And we will be hearing from you throughout the week and in the coming weeks with regards to some of the court cases and claims that you're going to be filing for your clients. So thanks very much for sharing your thoughts on this topic with us, Derek. And we will be touching base with you. And as those studies continue to come out, I'm sure that you're going to find them helpful for your cases coming forward.
Well, thank you for the opportunity.